Alright folks, how's it going? My apologies for not being able to conduct the exam and presentation in person today. So we're going to post this up on Brightspace for you to review your exam, to see if there's any issues or problems you had. Let's start with question number 1. Before placing a specimen container in a biohazard transport bag, what should the medical assistant do? And the answer was A, make sure the container is not leaking, there's nothing on the outside of the container. If there is, you need to double bag it and make sure that nothing gets contaminated. Remember that biohazard waste containers are red, so are the red bags that they use. All these other choices really kind of don't make any sense. What effect may anxiety have on a patient's vital signs? Well, they usually make them higher than usual. Pulse rate's going to be elevated, blood pressure is going to be elevated, respiratory rate may be a little elevated. Although it's normal for blood pressure to elevate a little bit in times of crisis, I mentioned before we cannot overindulge in that term white coat hypertension. That's not something that should be blown off. But anyway, that's for the medical provider to decide. When a patient's test results are abnormal, the medical assistant should inform the provider. Okay, that information has to go directly to the provider. The provider makes those interpretations and then discusses the results with the patient and then what to do about after that. Which instrument is used to examine the ears? And that would be D, an otoscope. An otoscope. Otic drops are medications used for the ears. The prefix oto refers to the ear. A sphygmomanometer, as you know, is a fancy name for a blood pressure cuff. You know what a stethoscope is, and an ophthalmoscope is something used to look in the eyes, which I think is one of your questions for later on. Which of the following microorganisms cannot be killed by alcohol-based hand rubs and can live on surfaces for months? And that answer was D, Clostridium difficile, C. diff, responsible for colitis. It's one of those spore-forming bacterias, very similar to anthrax, that is very, very difficult to kill on outside surfaces, usually requiring the use of an autoclave machine. Pulse oximetry reading measures oxygen saturation in the blood. More specifically, it measures oxygen saturation in the red blood cells, which can be falsely positive if patient has carbon monoxide poisoning, because it only detects the saturation. It doesn't detect what is actually saturating the red blood cell. So carbon monoxide poisoning kills you by bumping oxygen out of a red blood cell and taking its place. And the pulse oximeter will pick up on that instead. An autoclave uses steam and pressure, dry heat, dry gas, or radiation for sterilization. And as I mentioned before, that's the only device that can adequately eliminate all microorganisms, including your spore-forming organisms like C. diff and anthrax. All the following are pathogens except mosquitoes. Okay, so viruses, bacteria, fungi are all microorganisms that can be pathogenic. Mosquitoes are considered vectors, so they're means by which pathogens can be carried from organism to organism. All the following may cause errors in blood pressure readings except having the patient's arm at the same level as the heart. No, that's actually the way you want to take a blood pressure. You don't want the arm elevated, you don't want it dangling, wrong size cuff, deflating the cuff too rapidly, or waiting too quickly before taking a second reading can all give you erroneous readings. Medical assistant who notes that a patient is guarding his left arm is using this form of examination and as observation. Observation means looking at the patient. Palpation means touching the patient. Auscultation means listening for something, like listening for the blood pressure. And measurement, well, basically know what that means. Medical assistant will come into contact with microorganisms basically every time they touch something. Microorganisms are all over the place. Not all of them are disease-causing, but we still have to take precautions anyway. Before a surgical procedure, a medical assistant should review allergies and medications with the patient. That's just routine screening for any type of procedure. Before weighing a patient with a manual scale, the scale should be balanced at 0. So sometimes scales can be off. So you want to make sure it balances midline at the 0 mark. If it goes a little above or a little beyond, I meant to say below, then the scale needs to be recalibrated. If it can't be recalibrated, then you have to adjust for the difference in measurement from that 0 point. Correcting an error with an electronic record involves B, using a strike-through effect to mark out the error. Most electronic charting systems will record every single keystroke, whether it's meant to be or not. So if anything happens where there's a gross error in patient care and medical records need to be researched, very competent IT professionals can see everything that was typed into that keyboard, whether it was erased or not. So by using a strike-through, it shows that an error was made, no attempt was made to cover it up. For which disease can be airborne is the use of a special mask recommended, and that would be tuberculosis. Hand hygiene is washing hands with soap and water or using alcohol-based hand sanitizers. Soap and water, soap and warm running water with friction and adequate time is the preferred method, but alcohol-based hand sanitizers are good in a pinch when you don't have access to a sink and faucet. Hepatitis A is transmitted by fecal waste contamination of food and water supply. B, C, and D are all transmitted through body fluids via bloodborne pathogen route. How often should a medical assistant review a patient's medication and supplements during intake? And that would be at every visit. Medications, supplements, allergies always need to be reviewed, updated, and reconciled each and every patient encounter. How should the medical assistant handle disposable supplies used on a patient in isolation? The supplies should be discarded in the patient's room in an appropriate receptacle. Infections acquired in a healthcare facility are called nosocomial infections. Nosocomial infections. Acute infection is something that happens right away, like a sudden onset of influenza. Skipping down, a chronic infection. An example would be something like hepatitis B, which the patient carries for a long period of time. An opportunistic infection is an infection that normal, healthy people would usually not succumb to. These are infections due to bacteria or viruses or pathogens that generally don't cause disease because of a healthy immune system. But if the immune system is not healthy, say for example the patient has AIDS or is on immune suppressive drugs, then these organisms have the opportunity to become pathogenic and cause disease. Pain that radiates means it spreads out from where it begins to other parts of the body. A very common example would be chest pain from a heart attack, which quite often will radiate to the left upper extremity or to the jaw, sometimes to the back. Gallbladder issues can sometimes radiate to the right shoulder. We call this referred pain. Patients with droplet spread illnesses should wear masks. Properly positioned stethoscope earpieces are slanted slightly forward so they go in line with the ear canals. If they're pointed backwards, the opening is going to press up against the ear canal wall, and you're going to have a harder time hearing things. Recording information in chronological order means recording it in the order that it happened. First this, then that, then the next thing, step by step. Setting up a sterile field means D, setting up instruments and equipment for surgical procedures and maintaining a sterile environment. The body's largest natural barrier to infection, maybe it should say physical barrier too, but I guess that's pretty much implied, is intact skin. Once the skin is breached, however, then infection becomes more likely. The following are necessary links to the chain of infection. When a medical assistant gets a vaccination shot for hepatitis B, which link will be affected and thus prevent hepatitis B infection? And that would be C, susceptible hosts. So by building up the immunity from vaccinations, the medical assistant is becoming non-susceptible to the incidence of hepatitis B. Although nothing's 100%, it definitely helps. The following are necessary links in the chain of infection. When a medical assistant wears gloves, which link is broken, thus preventing the spread of disease? And that would be mode of transmission, or the way that the disease spreads. Although that doesn't work if the medical assistant wears the same gloves going from patient to patient to patient to workstation back to patient, because then you're just carrying germs with you for every single point. So for that reason, gloves should be changed after every patient interaction. The reason a patient is visiting a provider is called, or the main reason it should say, is called the chief complaint. And then usually the history of present illness stems off of that chief complaint. Single most important thing a medical assistant can do to prevent the spread of disease is to wash her hands. You will see this question in just about every medical course you take, from phlebotomy to EKG to medical assistant 101, even in medical school. So definitely know that. What does surgical asepsis create? It creates an area or object free of all microorganisms, disease and non-disease causing. What is one way that bloodborne pathogens can be transmitted? And when you talk about bloodborne pathogens, they are transmitted by infected blood entering the bloodstream through blood splashes, needle sticks, just for an example. What is used when a medical assistant counts an apical pulse? Well, to count an apical pulse, a stethoscope is used, and it's usually used on an infant because infants' heart rates are usually too fast to really count by palpation or by feeling. What waste containers are usually found in a medical examination room? And that would be a container for sharps, container for non-sharp biohazardous waste, and a container for regular waste. When is reusable equipment disinfected? After each and every use, at least the way it should be. So blood pressure cuff that's used on a patient should be wiped down and sanitized after each use. Not saying that always happens, but that's what should happen. When should a medical assistant report exposure to infection, blood, or body fluids? Immediately after the exposure happens, or at least as quickly as practical and possible. All right. The longer you delay, the less chance you have of successful treatment to prevent disease onset. Where are an MA's fingertips located while measuring a patient's respiration? And the answer there is on the patient's wrist. And the reason being, as we mentioned before, a little trick of the trade is to count the pulse first and then count the respirations without the patient knowing that you're counting the respirations. So this way they do not consciously alter their breathing patterns. Which is the correct technique when performing hand washing? Keeping the hands pointed down below elbow level so nothing splashes in your face. Which of the following is an MA responsibility related to infection prevention? And that would mean following standard precautions and caring for all patients. So regardless of how well you know the patient or how well you think you know the patient, you want to assume that all patients have some infectious disease that you want to protect yourself from. Which of the following is an example of a correct way to write a blood pressure reading? So that would be 120/75, written as a fraction. The 120 is the systolic blood pressure. The 75 is the diastolic blood pressure. The systolic pressure is the pressure exerted on the wall of the artery as the heart is contracting or going into systole. The diastolic pressure is the pressure on the wall of the artery as the heart is relaxing or going into diastole. Which of the following is true of wearing gloves? Gloves must be changed in between patients, just what we said before. Which of the following statements is true of disinfection? Disinfection kills some pathogens, but does not destroy all of them. If you want to talk about destroying all pathogens, you're using the term sterilization. Which of the following statements is true of hepatitis B, HBV? The vaccine for hepatitis B helps prevent the disease. It's a series of 3 shots, day 0, day 30, and then 6 months later, and at the end of which it confers approximately 90 to 95% immunity. which is very important. Which of the following uses of palpation is within a medical assistant's scope of practice? And that would be feeling for a vein before drawing blood. Determining the shape of an organ, that's a physician's job. Assessing a skin lesion, that's a physician's job. Checking for enlarged lymph nodes, that is the provider's job as well. What should a medical assistant report to the provider if he or she observes diaphoresis in a patient? Well, to answer that question, you have to know what diaphoresis means. Diaphoresis means sweating. So out of all those choices, profuse sweating would most likely be an indication that your patient might be having a heart attack. If they were dehydrated, they would be likely not sweating. Advising the patient to dress in lighter layers is kind of inappropriate, and it's not really the thing that we're worried about. And there's no reason to think it's a sign of dementia. Dementia is a long-term, ongoing process. A heart attack is a sudden, acute process. It's setting off that fight or flight, that sympathetic response system. With whom should a medical assistant use standard precautions? The answer is with every patient. Everyone. Oh, there's a lot of words here, right? But to make it short and sweet, a patient navigator streamlines the patient's healthcare experience by facilitating the patient's healthcare needs, encouraging compliance with plan of care, and helping the patient maintain or develop self-care skills. As we mentioned before, the whole medical system is very convoluted and complex, and patients, and quite often professionals as well, can have a very difficult time navigating through all the resources needed to accomplish their goals. Patient Navigator helps the patient accomplish this. A medical assistant with integrity will adhere to a code of values. An autoclave uses steam and pressure to dry heat, dry gas, or radiation for sterilization. I think that's a redundant question, but repetition helps learning. According to the U.S. Department of Labor statistics, job prospects should be best for medical assistants with formal training or experience, particularly those with certification. Certification. Do you need to be certified to work as a medical assistant? No, but it makes your chances of being hired much higher. It puts you above someone else. It's a good thing to have on your resume. Experienced medical assistants may find work as which of the following? And that would be all of the above. Office managers, medical record managers, instructors of medical assistant education programs. You can take my job from me. Those are all non-clinical duties, but important nevertheless. In many cases, who will be the first health professional the patient will encounter? Ta-da! You should have known that already. That would be the medical assistant. Usually a medical assistant greets the person at the door at the front desk. Another medical assistant may bring the patient to their room, get a preliminary history, screening, vital signs, way before the provider ever makes contact. Which of the following is not a clinical responsibility of the medical assistant? And that would be transcribing medical dictation. That would be more of administrative responsibility. Which of the following is not appropriate while working with patients nearby? This is really just common sense. Drinking, chewing gum, eating. Not only is that all gross, it's unprofessional and inappropriate, so the answer is all of the above. Which of the following is an administrative responsibility of the medical assistant? And that would be filing patient records, yes. A resting pulse rate above 100 beats per minute is known as tachycardia. Bradycardia would be defined as a resting pulse rate of below 60 beats per minute. Now, just because something's a little bit below or a little bit above doesn't necessarily mean it's pathologic. It's just a term we use. The term tachypnea refers to rapid breathing. The term bradypnea, as you figured it out by now, means slow breathing. A tympanic thermometer is advisable for taking the temperature of, the answer is small children. And to answer that question, or you have to know what a tympanic thermometer is. A tympanic thermometer is used on the tympanic membrane, which is otherwise known as the eardrum. So a tympanic thermometer is one of those thermometers that are used in the ears, which is good for small children who have a hard time sitting still for a long period of time. All the following may cause errors in blood pressure readings, except, and once again, the patient's arm is at the same level of the heart. That's how you should be taking a blood pressure. Microorganisms occur everywhere in nature and have several requirements in order to grow. Which of those are requirements? Suitable temperature, moisture and darkness, food, all of the above. Personal protective equipment includes face masks, protective eyewear, gloves, all of the above. Okay, so moving on. Secondary hypertension may result from any of the following except, and the answer is D, no known clear cause. When you have hypertension of no known clear cause, then we call that essential hypertension, which accounts for probably about 90% of all hypertensive cases. They can control it, they just can't figure out what's causing it. Standard precautions issued by the CDC involve all the following except dietary restrictions. Although the CDC may talk about dietary restrictions to help prevent certain things like hypertensive disorders, cardiovascular disease, diabetic issues, it's not part of what you would consider standard precautions. Standard precautions pertain to infectious diseases. Which is the most accurate and reliable means of taking a body temperature? And that would be taking a rectal temperature, which is usually done mostly in a critical care situation or emergency situation. Sterilization is the destruction of all microorganisms, both pathogenic, disease-causing, and non-pathogenic, non-disease-causing. A symptom is a subjective experience of the patient that cannot be observed by anyone else. So chest pain, headache, nausea, these are all symptoms. They're subjective. They cannot be observed on the outside. They cannot be measured. You can observe a patient's response to these symptoms, but you cannot observe the symptom itself. A goniometer is used to measure range of motion in a joint, and that's usually used in orthopedic and physiatrist offices. Medical assistant with integrity will adhere to a code of values. I think this is another redundant question, but just remember what the term integrity means. It basically means doing the right thing even when nobody is watching you, or at least even when you know nobody is watching you. Patient in the supine position is lying on the back, face up. On the left side would be considered lateral recumbent. If they're laying down on their stomach, that's usually considered the prone position, and you really don't ever want to have a patient in that position because it can cause airway compromise. Right side can be used as well. We would still call that lateral recumbent. Resting pulse rate above 100 beats per minute, as we said before, is tachycardia. A type of hypotension involving a temporary fall in blood pressure that occurs when a patient moves rapidly from lying to a standing position is known as orthostatic. So whenever you get up out of bed in the morning, your body almost goes through the equivalent of a 2-liter hemorrhage. The reason you don't collapse on the floor, for the most part, is because your cardiovascular system is very efficient at keeping up with the changes of gravity. When a person is volume depleted, if they're going into shock, they don't necessarily catch up as easily. So if the blood pressure drops from supine to sitting position and patient becomes symptomatic, that's called an orthostatic change, and it's an important sign to observe. All the following are pathogens except mosquitoes. We talked about that. Confidentiality is the ability to maintain privacy. Experienced medical assistants may find work as which of the following? They can be office managers, medical records managers, instructors of medical education programs, all of the above. I definitely got to redo this test. Infants are especially susceptible to infection because their immune systems are underdeveloped. They get a little bit of immunity at first from antibodies passed over to the mother. Those antibodies wear off after a while, and then the infant has to develop their own immune system over time, and vaccinations. Pathogens that are capable of producing disease grow best at a temperature of, you guessed it, normal human body temperature, 98.6. That's why when your body detects an infection, it mounts a fever and elevates the body temperature to make the environment less hospitable to pathogenic organisms. Personal protective equipment includes gloves, protective eyewear, face masks, all of the above. Secondary hypertension may result from all the following except no known clear cause. An ophthalmoscope is used to examine internal and external structures of the eye. The sitting position is ideal for auscultation of the heart and lungs during the physical examination. Can't really auscultate lungs adequately if a patient is lying down. The lateral recumbent position requires the patient to lie face down, flat on the stomach, head turned to the side, arms alongside the body or crossed under the head. The ability to work with the sick and infirm depends on one's ability and willingness to show empathy, putting yourself in that patient's shoes. The characteristic that refers to the regularity of the beats of a pulse is called the rhythm. Is it a regular rhythm where it goes beat, 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 or is it an irregular rhythm where it goes beat, 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 beat? You can tell the difference. The first mild signs and symptoms of an infection begin to appear in what's called the prodromal phase. That's when you first start feeling like something's wrong, but hasn't progressed to full-blown illness yet. The incubation period is when the body is exposed to the pathogen, but hasn't mounted any type of signs or symptoms yet, because the pathogen is still growing and brewing. The medical assistant's role in the physical exam includes all the following except doing a review of systems. Patient's concern that is not a sign is dizziness. Dizziness would be a symptom. A rash you can observe visually. Weight loss can be measured. Fever can be measured as well and observed. Dizziness is completely subjective. The physician auscultates the sounds of the heart and lungs for that matter using a stethoscope. The radial pulse site is located at the thumb side of the wrist, about 1 inch below the base of the thumb. The semi-Fowler's position is similar to the Fowler's position, with the head of the table is at a 45-degree angle instead of a 90-degree angle, which is the true Fowler's position. To provide each patient with a new and sanitary thermometer, the electronic thermometer is fitted with a disposable probe cover. It's a good way to avoid MRSA infection, methicillin-resistant Staph aureus. Well, perform hand hygiene, wear gloves and other personal protective equipment, use antiseptic cream to cover and bandage cover cuts, so all of the above. Where is normal flora located? Oh, sorry, I didn't answer that one properly. Normal flora is located in the urinary, GI tract, respiratory tract, in the trachea, on the skin. So the answer to that, even though it's not keyed, would be all of the above. All of the above. Which ambulatory care setting below best matches the job description of caring for patients who require immediate medical treatment? That would be, out of all those, urgent care facility. Which ambulatory care setting below best matches the job description of providing care for patients recovering from illness or injury? That would be a rehabilitation center. Which of the following is not a clinical responsibility? And that would be coding procedures, performing dressing changes, prepping for x-rays, assisting the physician during procedures are all clinical responsibility. Coding procedures are administrative responsibilities. Which of the following is not an administrative responsibility of a medical assistant? Giving an injection, that is a clinical responsibility. Greeting and receiving patients, petty cash, reconciling bank statements, those are all administrative, managerial responsibilities which fall under the scope of the practice of the medical assistant. Many office managers in many facilities were probably once medical assistants prior to their promotion. Which of the following is not appropriate while working with patients nearby? Drinking, chewing gum, eating, all of the above. Which of the following is a clinical responsibility of the medical assistant? obtaining patients' vital signs. Which provides barrier protection for caregivers to prevent the spread of infectious disease. Gowns, non-sterile gloves. Most gloves do not have to be sterile for routine patient interactions. Sterile gloves, all of the above. Manipulation is passively assessing the range of motion of a joint. And finally, question 100. Hyperventilation refers to deep, rapid respirations. And that is the end of your Exam 1 review. This will be posted and kept up for a limited time only. Ta-ta.